Hello, everyone. This is Michael from Blue Sky Bio. I'd like to welcome everyone who's joining us today for tonight's webinar presentation. We are continuing with our 2022 webinar series. Information regarding the schedule of upcoming webinars can be seen at blueskyplan.com/webinars 2022. And we have links there to past recordings for webinar presentations as well. The webinars definitely build on each other and are connected to each other. So if you missed any past presentations, definitely recommend checking out the recordings. And of course, see the schedule for upcoming presentations. All of them could be attended at no charge, and all of them award 1 CE credit. A few technical items before we get started. If you have any questions during the webinar presentation, please enter them into the question and answer QA box. We'll be sending the CE credits via email, usually within a week or two after the presentation. And as I mentioned, the webinar, barring any technical difficulties, will be recorded and will be available on our website and social channels within a couple of days after the webinar presentation. I'm really excited about tonight's webinar presentation. We have the pleasure of hearing from Dr. Rick Ferguson. Dr. Ferguson lectures around the world, is the Director of Implant Educators, a 7-month program teaching how to become implantologists. Dr. Ferguson has been teaching for more than 20 years in topics related to implant placement, bone grafting, and a wide variety of dental topics, in addition to his private practice in Florida. Dr. Ferguson is a good friend of Blue Sky Bio. He's developed the famous Ferguson technique that we have in the BlueSkyPlan software. And I must say that when I speak to dentists and when other webinar presentations are given, he's one of the most referred to dentists that come up during presentations and conversations. Tonight, we're going to have the pleasure of hearing him speak on dental 3D printing and BlueSkyPlan in 2022, use parameters for dental 3D printers, and the role of BlueSkyPlan. Rick?
Thank you, Michael. And let me say, first of all, it is my honor to be here. Thanks for inviting me back because I'm always excited to present on BlueSkyPlan. BlueSkyPlan is the foundation for what we do in all of our courses now, not just our digital courses, but also our implant training courses. We have adopted it into our implant continuum, and you'll get a chance to see actually a case we did recently. But you know, as you mentioned, we do have courses that we teach implantology and of course, digital dentistry. And as I always like to say, you know, our home base is our private practice, myself with my wife, Dr. Catherine Ferguson, where we have technology such as CBCT, intraoral scanners, 3D printers, and of course now we do our own milling as well. And again, BlueSkyPlan is the foundation of all of this. This is our 3D printing area. You can see all the different current 3D printers that we're using. This is an up-to-date photo showing our workhorse printers. I have several other printers. As a matter of fact, here is a partial list of all the printers that I've used and tested in the last 5 or 6 years or so. You know, some mostly dental, but some non-dental printers as well. And of course, we run the Facebook 3D printing group where we supply information to folks who are using all of these different printers. And it's a great place for sharing knowledge about 3D printing. So what I'd like to do today is actually answer some of the questions that we get in that group. You know, there are a lot of different 3D printers, just a ton of them on the market now. And people are go to that Facebook group and want to know how to use them, what the parameters are, what the settings are, which ones can be used for what, which resins work with different printers. And some of these printers are open and closed. And so I just want to go through a few of the printers, our current lineup of printers, so to speak, the ones that I am currently using. And that, of course, changes from time to time. But you'll see that if you've seen my past presentations, there are some brands of printers that are still with us that we still use every day, and those are our workhorses. And you saw those on the previous slide. So just a quick review of 3D printers. We started off with FDM printers with BlueSkyPlan. The Cell Robox was one that Blue Sky actually was carrying. We went to SLA, we have DLP, LCD, SLS, and microjet printers. SLS and microjet are not widely used because of the complexity and the cost of those printers. But basically, this is the technology that we have with an FDM printer. What you have is, it's kind of like a hot glue gun. You build up layers of materials, and it's a slow printer. The material selections are low, and we started out using those for surgical guides, but we quickly moved away to the SLA type printers. Now, the SLA type printers, we use a liquid resin, and this is similar to the Formlabs technique. This is an older technology, but of course, it became very popular. Now, the issue with SLA type printing is that because it's using a laser to trace a path and cure a line of resin, it's a slow process. So it's not printing an entire layer at a time. It's actually tracing a layer. So it's a slow process, but it's also a very reliable process. And that's why we are still using, for example, the Formlabs printers. And then we have DLP. DLP is faster because it's printing an entire layer at a time. It uses basically a projector similar to the ones that project images in a movie theater. But it's be able to project an entire layer at a time. So you can cure an entire layer at a time. And it's much faster because of that. Also, the power output on it is fairly high compared to the next type of printer, which is the LCD. With an LCD printer, what you have is an LED light and then a masking LCD, which blocks light and only lets light through in a certain pattern. So an example of this is the accuretta Soul printer, which is what you see here. This type of printer is also very fast and it can be very accurate, but it has drawbacks because the life of the LCD tends to degrade with the UV light that's being projected through it. And then we have things such as SLS, or selective laser sintering, which is again using a very high powered laser to cure a powder. And this is used actually in dentistry for metal 3D printings for doing things like partial frameworks and such. Not widely used, of course, in a clinical practice, but laboratories will use these types of printers. We're not going to really talk about those because the things that BlueSkyPlan can produce really don't work with that. And then we have microjet, which is kind of like an inkjet technique where very small jets of material are laid down in layers again. And you can see then we have the UV light that immediately cures it. And this goes back and forth over the different layers and builds up the material. So all of these techniques use use the same layering technique. The microjet is nice because you can produce different colors in the final printed object, but it is a very complex. There's a lot of moving parts, and because of that, it's also very expensive, a very expensive process. So we're again typically not using microjet printers in a clinical practice, but some laboratories do use microjet printers as well. So just to summarize, FDM, slow, low resolution, limited applications. SLA, slow but accurate. DLP, fast, accurate, but tends to be a little bit more expensive because the DLP projector is more expensive. LCD is fast, accurate, low cost because LCD screens are cheap to produce compared to the DLP projectors, but the lifespan of the LCD is short and they tend to wear out and need to be replaced. SLS mainly used for metal, complex post-processing involved in that as well because of having to remove the metal support structures. Microjet, slow, expensive, complicated, and there's a high maintenance factor with that as well. Now, if we look on the Blue Sky website, you'll see that some of the printers that we are going to talk about are actually for sale there. And I'm just going to switch my screen real quick and go to that website because I do want to point out that the Formlabs resins and the Formlabs printers and the SprintRay Pro 95 and SprintRay Pro 55 printers are available from that website. And if you click on the Formlabs printer, for example, on the Blue Sky website, you'll see that all the accessories are available there, as well as the different resins. And I'll talk about some of these resins today. and their applications and how we're using them. And also the same is true for the Sprint Ray products there as well. So if you click on the Sprint Ray Pro 95, you can see all the different accessories and resins there as well. So those are all available from Blue Sky Bio from their website. And then one thing I did want to mention, I don't own a Jewel printer, but Jewel is also another printer package that's available from Blue Sky. And of course, if you just want to go quickly to the resins, you can click on the materials here and they have all the resins. We will be talking a little bit about this Onyx resin. It's a fantastic resin available for now from Sprint Ray. And then one other thing I did want to mention, which I've been very, very excited about, is the ProCure 2 from Sprint Ray. This is a new product that has also been updated recently for us by firmware that allows us to cure our temporary hybrids in under 5 minutes. So this is really a nice post-cure product to get. And that will work with multiple printers, but of course it's got the settings for the Sprint Ray resins and so on. So just wanted to quickly share that so that you know where to go if you need any of those products. So let's go back to the PowerPoint here. So you should be seeing my PowerPoint again. And these again are the printers that we are using basically on a daily basis. Now, I did put the price points on there for these different printers. We have been using the Formlabs printers for at least 5, almost probably 6 years now. Recently, we started using the Sprint Ray Pro. I had used the Sprint Ray Moon Ray product before. And of course, I always like to include in our printer lineup a low-cost 3D printer because I don't want 3D printing to be inaccessible because of budgetary constraints. So the printer that we are currently recommending on the low end scale is the Frozen Sonic Mini 4K. And you can actually print some of these Sprint Ray resins, some of the other resins, such as the NextDent resins, which are dental resins on this particular printer. And actually on the Blue Sky Bio site, you can buy resins from Keystone, the Key Splint Soft, for example, that prints nicely on the Frozen Sonic Mini 4K printer. So you can see the resolutions are actually pretty high on that little printer. What you're not going to get with the lower end printers is not the bells and whistles such as Wi-Fi and more robust software, etc. All right. And then I did want to mention Accuretta Sol because this is sort of a great printer that we've been using recently that has great support. It is dental. It is a dental printer, and that means that they have validated a lot of different resins for this particular printer. And this is another one that we're using on a daily basis. So as you can maybe remember from the image I showed where we had all these different printers, what's nice when we have different printers or multiple printers is that we can print different materials without having to change out the tanks and change out the settings in the printer. So for example, the Sol is a printer that we're using right now to print night guards and surgical guides and things like that. Whereas the bigger printers, this has a smaller build platform compared to the Sprint Ray 95 or the Formlabs 3B. For models and such, we're typically printing those because we're doing a high volume of models. We're typically printing those on the Formlabs printer. And another printer that we've just acquired that is actually a pretty good printer is this Shining accufab printer, which is sort of a medium range price point. Again, it is a LCD type printer, but Shining, of course, has been in the dental field for a while. And I know Blue Sky at least used to carry some of their desktop scanners. But this is printer that's sort of new to the market, but they have actually some really good resins, which we are using for doing things like making aligner models, which I actually have one of their aligner models here. And I've actually reviewed that printer on the 3D printing Facebook as well. So this is another printer that's available, has a larger build platform at sort of the low to medium price range. And also you should get good technical support from this company. It also has pretty robust software, whereas the Sprint Ray and the Formlabs, for example, will have more robust software that you can create models and such with directly from intraoral scans. That's actually also built into the software for this particular printer. And then another company that I've really liked is the Frozen print company. And I know also that Blue Sky have carried some of their printers in the past, but this is another printer that's the Sonic XL 4K 2022. It is a larger build plate. You can print many models on there, probably about 16 models or so. And it's also very accurate because it has a 4K screen, and they carry different resins. And it comes with a slicer that allows you to print and customize the settings, such as the sport settings, for dental applications. So you can see this model that I printed here, which is an analog model, and then the surgical guide that fits on it for a bone reduction stackable guide case. This was printed on this particular printer. And one of the things that I really like with this printer is they have a resin that's water washable. So this model resin here is a very high resolution resin that is water washable, so you don't have to use isopropyl alcohol. One note about that, you don't want to mix these resins. If you're using water washable resins, don't use conventional, wash them in the same wash basin as the ones that use isopropyl alcohol. And interestingly, I got this message from Charles Payet yesterday. He bought one of these printers, and he just made a note here. He's recently gotten into doing models with this particular printer, and he says, I absolutely love being able to take scans from patients, edit them in BSP, BlueSkyPlan for models in 5 to 7 minutes, set them up in the frozen slicer in 2 to 3 minutes, send them to print and have them printed in 9 minutes, wash in a couple of minutes, etc. No messy impressions. Patients can keep the models to be used, etc., etc. And I know also he just, on my recommendation, bought one of the ProCure units from SprintRay to speed up his post-processing time. So he's trying to get away from stone in his office, and he really appreciates this printer as well. I know he had a Formlabs printer before. One thing about these different resins is that you have to make sure that you are using FDA cleared resins, and of course all the resins from especially the ones that are going in the mouth, all the ones from SprintRay and Formlabs, and also the NextDent resins are FDA cleared, so keep that in mind. Of course, if you are printing just dental models and don't care about they're not going in the mouth, you can use some of the lower cost resins. And this is basically the FDA classifications of different materials. Class 1 are custom trays. These are things that are going in the mouth, surgical guides, indirect bonding trays, and try-in. There are resins available for all of these things. Class 2A, we have dentures, splints, temporaries, and of course now we have printable materials that can be left permanently, such as for permanent crowns. Now, whether they're strong enough to last, many years, is a debate right now. But the materials are actually getting better, almost on a monthly basis. So these types of resins, of course, have to be class 2A for long-term use in the mouth. All right, just keep that in mind. Now, the printers themselves, and I have my list of printers here again, ones that we're currently using. The printers themselves will come with their own software for doing the slicing or preparing the models for 3D printing. So the Formlabs has their own. Michael, are you there?
Yep, I'm here.
Can you still see my screen?
Yep.
Oh, for some reason Zoom popped up on here. Okay. All right. Yeah, as I was saying, the slicer software is, of course, dedicated for each printer. So the Formlabs software is called Preform. It is a closed system, so you can't use easily third-party resins, although there are a few hacks to be able to do that, but it's not easy. It's mostly a closed system. The SprintRay is partially open in that SprintRay will validate third-party resins. And of course, they have their own resins as well. And their slicer is called Rayware. Now, they are going to a cloud format for doing the slicing, which holds a lot of promise because, you know, if you're tired of constant software updates, which we get all the time, we get those from BlueSkyPlan also. But it seems like with these slicer softwares, they're always going to be, they're constantly being updated. So I think SprintRay is moving to a cloud-based slicing platform. Accuretta has a partially open system as well, in that you can't go in and change the settings, but they have validated third-party resins, and of course they have their own third-party resins. Their slicer software is called Alpha 3D. What's nice about Alpha 3D is that it actually automatically updates. So it's been pretty easy to use that software. Frozen XL 4K22 was designed as a dental product. So they have what they call their dental synergy slicer, which has automatic settings. So if you're printing, for example, a dental model, it will recommend certain support settings, right? And if you're printing a surgical guide, it'll recommend certain support settings for that. And you can print at a high resolution, a lower resolution, et cetera. It makes it sort of like a wizard workflow, as opposed to having to put all the settings in manually. And these printers that you see on here, all of them actually that are on the screen come with dental resin settings built in already. But the Frozen XL 4K is kind of like the Formlabs, SprintRay, and Accuretta, in that they will recommend, depending on the type of model you're printing, they'll recommend certain settings. The Frozen line of products are fully open products, in that you can actually go in and change the settings and put in, you know, figure out your own resin settings for a particular resin that maybe is not in there already. There is another company called epacks out of North Carolina, near Charlotte, I believe, that sells a printer similar to the Frozen line. They all use the slicer called Chi2 Box, which is sort of an open slicer. It works with many different printers. And that is also another, they do have a dental version of their printer as well. And the idea here is that these are LCD printers, but with epacks, you'll probably get better support, as far as you'll be able to call the company and get some support, whereas the Frozen, you probably won't be able to do that. You have to do everything online. So if you want that extra level of support, but are interested in a lower cost LCD printer, then epacks is one of those companies that have actually have gotten good reviews from folks that I know who have used that printer. And that's, again, a fully open system because they're using this Chi2 Box slicer software where you can go in and change all the settings manually. Of course, they also have their printer validated by KeySplint and Whitmix and some of the other companies that make resins. And then we have, again, the Shining printer. Their software is called AccuWare, and this is partially open, meaning that they also have to validate the resins, but they do support third-party resins from some of the same companies I just mentioned. And of course, they have their own resins. Now, just real quickly with this Chi2 Box-based software, because it supports several different types of printers, you can see some of the printers I've used over the last year or so with this particular printer, with this particular software, and they do supply some of the settings for the resins. Now, one thing to keep in mind is most of the time their settings are going to come to print at 50 microns, which is kind of slow. I prefer printing most things at 100 microns. So that's, you know, we'll go in and change and figure out some of the resin settings, and I'll show you how we share that information as well. And one thing I do like about this Chi2 Box software is that they have something called tolerance compensation. And this means that if you're printing something that you know, has a hole in it that you need extreme amount of accuracy, such as a temporary hybrid where you're printing for the screw holes to go through, they do have a compensation for that inner hole that you can change, and that's this one right here that I'm showing, the compensation A. And we found that if we're printing, for example, a hybrid, you change that to minus 0.1 millimeters, and we find that the screws will literally just drop in and the prints will be very, very accurate. We'll look at that in a second. This is what I'm talking about here. So this is, for example, a temporary hybrid, and this is a Rosen screw. This is going to go direct to a multi-unit abutment. And by changing that to -0.1, we find that once the settings are dialed in, if your screw holes are a little bit tight, just you can compensate for it right there. Frozen has a new printer that's on the market, which is an 8K. It's called a Frozen Mini 8K. And I was one of the first people to get one of these so we could do some testing, and it's a really high resolution printer. As a matter of fact, when we printed these types of hybrids with it, they came out very, very smooth. But beyond that, the holes for the screws were just dead on without having to use this compensation feature. So that's a printer that folks might want to look at. It is an LCD printer, so and it's not, it's a plastic body and all that, so don't expect it to last forever. I look at these lower cost printers as sort of disposable printers. You can change the LCD screens in them when they go bad, but the electronics and so on in there are not as robust as some of the more expensive printers, even some of the more expensive printers that Frozen makes. But you can see we can still get a very good print for a hybrid or for a, and this is NextDent MFH resin, by the way, and for surgical guides with the NextDent resin there as well. So information on all of these different printers and so on, and sharing of information occurs on our Facebook dental 3D printing group. And the one thing I am going to show you here is if you go to the main screen and click on this more button and then go to the file section and search for this file here, Ferguson Resin Profiles. It's an Excel spreadsheet that I have where I share all of the different resin settings for the different printers, so that even on some of the lower cost printers that maybe don't have particular resins in there, folks around the world have worked out the settings. I worked out a fair amount of them myself, but they share it, and I have this ongoing Excel spreadsheet that I update from time to time based on when I basically have time available. So that brings us to what are we going to produce with these different printers. And of course, as I said, BlueSkyPlan is the backbone for what we do in our digital dentistry, in our practice and in our courses as well. You can see some of the products here that Blue Sky has sold over the years. This is actually a current image from the Blue Sky website, but some of these products they don't sell anymore. I don't think they sell the Shining lab scanner anymore, or the Robox, of course, that's the old FDM printer, or the Moonray S. But what's nice about Blue Sky is that they stay updated with their products, such as with the 3D printers, etc. So if you open up the main screen of BlueSkyPlan, you will see all the capabilities here. And I was just talking to Michael just before this webinar about some of the new and exciting things that they're going to be adding to BlueSkyPlan. It's an ongoing evolution, and sometimes I was saying to him, it's hard for me to even keep up with some of the innovations and things that they're doing. But we of course thank them for providing the software at a reasonable cost that again makes it reduces the barrier for folks to get into 3D printing and designing and doing some of these things. So we of course can do surgical guides, orthodontics, dentures. It's great for model editing, crown and bridge, cephalometric analysis if you are doing orthodontics and such. But if we look at the main things that we're using BlueSkyPlan for, we're using it for models, of course, surgical guides and dentures and aligner models and crowns. And then these are some of the resins based on the printers that you might choose. With the Formlags, for example, we're recommending the Model V3 resin for models, Dental SG resin for surgical guides. They have denture resins. A Draft V2 is a great resin for aligners, and temporary crown and bridge for crowns and hybrids and so on. And of course, Sprint Ray has their Dye and Model 2 resins. And you can see some of these have versions that they update the resins from time to time. And that just doesn't mean changing the color. The properties for the particular application will increase. the speed of the resins, which is interesting because Formlabs has been known as a slow printer, but their Model V3 resin has actually allowed their current line of printers to print much faster, at least a 30% increase in speed. So as the companies develop new resins, they will change the name of the resin, even though the application is the same. So Sprint Ray's on their 3rd generation surgical guide resin. They do use the DENCA brand resins for their dentures. That's a 3rd-party resin, so they don't make that, but they're a reseller for that. They have a great Dyne model resin. Of course, one of their most exciting recent resins is the Onyx, which was designed actually for hybrids and temporary crowns and bridges and so on. What's nice about the Onyx resin is that it's highly polishable. It's a ceramic filled resin, so you can actually polish it. Even if you don't want to put a glaze on it, you can polish it and get a nice shine to it. We have Accuretta, their Curo model resin. They do support NextDent SG, NextDent denture resins, the Curo model for aligners, and the NextDent MFH for crowns. Frozen, they have their dental model water washable, which I talked about earlier. They do support NextDent resins for surgical guides and dentures. For aligner models, we have used a 3rd-party resin called Apply Labworks, and we have the settings for that. It's a low-cost resin that actually has some very good properties, but we've used that for many years, so I do like the resins from that particular company. They tend to be of very high quality. And then because Frozen is a completely open system, we have actually been able to print Onyx, the NextDent MFH, and the Flexera from EnvisionTech on that printer as well. And those settings are available on the Dental 3D Printing Group. Epacks has their own model resin, NextDent SG, NextDent, their epacks model resin for aligner models, and of course NextDent. They do also support the whip mix model resins and some of the other dental companies resins out there, such as the KeySplint, KeySoft products. Accufab, they have their own model resins, their own surgical guide resins, and they also do support NextDent, such as the MFH and their denture resin. So Accufab is the shining product, a new printer on the market. So what are we doing with all of these products, And look, I'm one of these folks that have a ton of different printers, and because I'm in education, teaching 3D printing, and also because I run that Facebook group, I have a lot of different printers, and I'm not telling everybody to go out there and buy a bunch of different printers. You should start off with a good quality printer. If you want to go to some of the lower cost printers, that's fine. Also, just understand that you are going to have to put a little bit more time and effort into those, but they are good actually for learning 3D printing and sort of deciding whether 3D printing is for you. So that brings us to Alan. So this is one of the first indications, I think, for doing 3D printing in office. Alan's 63 years old, and he presents, with this dentition where he's lost his vertical dimension. He has a lot of wear on his teeth, and we need to do a full mouth rehabilitation on him. So now we have to sit down and talk about how we're going to accomplish this. So typically for a case like this in the past, what I would do is have the lab do a wax up, traditional wax up, get them some stone models, and they will open the vertical and take wax and wax in all the teeth. And that was a very expensive proposition for us because it would cost probably $600 to $900 for the lab to do such a wax up. So today, what we do is we do it digitally, of course. So we'll get intraoral scans. And what we'll do is probably in a patient like this, we'll take a leaf gauge bite, open the vertical quite a bit actually. In this patient, I think I opened a vertical about 7 millimeters. This is not Alan's picture, but this is how you'd go about doing it. We take a leaf gauge bite and bring those in, with your intraoral scanner. You can actually scan the upper and lower jaws and then have the model of that bite registration with the bite open like that. So we'll bring this into BlueSkyPlan, for example, and then use the denture module to set up a set of teeth. I'm not going to walk you through that. There are other videos on how to do that. I know Corey Glenn has some great videos on how to use the denture module on YouTube. So, but we'll go through and set up a set of denture teeth for a model, like for a case like this. And then what we will do is go into the model editing module. And that's, again, something that's nice about Blue Sky is you can actually switch between the modules very easily. And we'll go in and just sort of paint away any of the underlying teeth that are showing through our wax up. And then we can quickly do a wax up. Now, the last step of this, of course, is making these solid models. So this can be done very quickly. Of course, you can outsource this as well. But once you've got the teeth and painted in and modified the underlying model, we can then take the green and blue model that you see here and make those as solid models, and then export those out of BlueSkyPlan with the teeth attached. And then those are now ready for 3D printing. So this is one way to lower your cost and be a little bit more efficient with your time if you want to get this case turned around very quickly. So that's actually what we did for this patient. We sent those out, we exported this out and then as STL files with the teeth attached, and then printed those models. So we then bring the patient back for a consultation appointment where we're going to talk about how we're going to achieve the goals here. And what I like to do is print the pre-op models in a resin. This is the Apply Labworks resin. It's sort of a brownish, orangish resin. And then the newly waxed up or digitally waxed up model, I'm going to print in white. And this has a little bit of a psychological effect on the patient. So, you're transitioning them from old to new, so to speak. So what we did here was I had a consultation appointment with Alan. His wife happened to come with him, and we sat down and we talked about how we're going to approach his case as far as opening his bite and adding crowns to restore his vertical dimension. And when you put the time and effort into these types of cases, it pays off, because what happened was at that appointment, and of course you can imagine the fees that are associated with a case like this, because we actually planning to do implants in the lower posterior, where he's missing some teeth there as well. So we've got a full upper and lower crown and bridge case with lower posterior implants, 2 or 3 implants on each side. And you can imagine the fees that are involved with this. But when you take time and effort to sit down and actually discuss this properly with the patient and show them how you're going to do it, and they understand and they know that you care about how you're going to approach this. And what's interesting is when we do case presentations like this, a lot of times what happens is like what happened here with Alan. He wrote us a check for half the fee right there and then to get started. So this is the time to do that, to spend a little bit of time and really explain to your patients what's going on. One of the main reasons patients don't accept treatment is because they really don't understand what you're trying to achieve for them and how you're going to go about doing it. So this allows you to make a nice treatment plan for the patient, sit down and talk to them, and then show them what your goals are for them. Of course, you're not going to promise that this is what they're going to get, but that's what we did here. And then the next step for Alan's case was actually to create a Anterior Deprogrammer. So you can actually do this in Blue Sky, even though that's not one of the things that was listed there. There is no splint module in Blue Sky at this time, but hopefully there will be soon. But you can actually use the surgical guide module to create an Anterior Deprogrammer. So what's interesting is I actually made this video this morning because I wanted to demonstrate how to do this, and I decided to go back and use Alan's case to do this and show you how to do this. So we did put Alan in the Anterior Deprogrammer before we made his temporaries. So we create a solid model. That's the first step from the intraoral scan. Then we create a surgical guide, basically, of 2 millimeter thickness. That's what it looks like. And then I will bring in a model of the anterior portion of the deprogrammer. Now, this is something that I have already created. If anybody wants this, which is the yellow part that you see there, I'll be happy to send that to you. Just send me an email. And then what we did here was, because this block, this yellow block that you see here is solid, it's actually coming through the deprogrammer. So what we do is we go to the crown and bridge module and use the Boolean subtraction technique and subtract out this part here, the green model from that. So if you look here, we'll see that the green model here, let's go back a second here. I'll try to pause it right there. The green model was subtracted, and now we have this blue model, which is basically like a tray, and this part here, which is going to be the anterior deprogrammer. And then we can again export this out to BlueSkyPlan, from BlueSkyPlan to our 3D printer. Now, here also, what you're seeing here is I actually brought this into Mesh Mixer. One thing you'll want to do is go into Mesh Mixer and make this solid, and make sure that you choose the accurate type. When you do solid type, make that accurate, and then this is ready for printing. So you could also use the smoothing tools in BlueSkyPlan to make it smooth and look something like this, so it's a little bit more comfortable for that patient. But that's one way to do an anterior deprogrammer in BlueSkyPlan. And if you want the block that fits on the front here, just email me. I'll be happy to send it to you. It's just a triangular block that I created in Mesh Mixer. Not very complicated to do. And to get it onto this part here in Blue Sky, you'd want to just use the model manipulation tools. Okay. So once we put Alan in this anterior deprogrammer, we're going to get him back in and prep out the upper and lower teeth and put him in temporaries. So these are 3D printed temporaries made from the digital wax up. These are shell temps. And right now, there's not really a good way to do this in Blue Sky. So you'd probably want to outsource the creation of these shell temps or use a different software to do it. But that's what we did here. We 3D printed these. These were printed on the Formlabs printer using the crown and bridge temporary resin. And we brought him in, prepped out the teeth, put these temporaries in. And once we've verified that he's happy with the temporaries, we will actually go ahead and use the STL file from that to make guides. And we went ahead and put the implants in the posterior jaw and the lower posterior jaw. And then, of course, we can take impressions, final impressions, once we've verified the patient's happy with the temporaries, the aesthetics, the function, etc. These are now the final zirconia crowns. So you can see how the final zirconia crowns look very similar to the temporaries. We changed the vertical dimension, made sure that the patient was able to accept that. And then once that's done, in this case, we used a very high strength zirconia crown because, of course, that's what, his patient's a bruxer, and that's what got him into this problem to begin with. All right. And there is his new smile. So just in a few appointments, and very easy to do. You don't have to have a lot of technical skills necessarily to do this kind of case. Most dentists are fully capable of treating this particular patient, but very straightforward and very efficient in how we're approaching this. All right. Of course, we have been using BlueSkyPlan for aligners as well. And last year, we started teaching BlueSkyPlan as our primary aligner software because of all the evolution that has occurred with this particular software and the ease of use and the functionality that's been built in. So here's a case that I recently planned. You can see the tooth movements. You can generate reports. The models will come out with the bases already attached. And of course, I'm not here to teach you how to use this. There are lots of videos and such. And if we do give a course on this as well that's taught by Dr. Reynal Gonzalez on how to use BlueSkyPlan to do your own in-office aligners, and so on and so forth. So here are the aligner models that are output from the BlueSkyPlan software. We set them up on the build platform. This happens to be the Formlabs build platform. And I believe there are about 18 models on this. So typically we're printing these at night. So the slower speed of the Formlabs printer doesn't really bother me so much. It is a very reliable printer, very robust printer that we've come to rely on in our practice. We have 2 of the Form 2 printers and 2 of the Form 3B plus printers now. But our Form 2 printers still are, the main ones we're using for aligner models, and that's going on like 5 years now. We have had to have a few of them serviced over the years, but again, they're very robust technology. All right, here is on the lower right here, these gray models, these are on the Formlabs printer. And then on the upper left, that's actually on the Shining printer. You can see how many models we were able to print there. So our workflow involves my assistant coming in the morning and taking off the prints off the platform and then putting them in the wash and the post-cure oven and so on. And that's all done by my assistant in the morning, and then they fabricate the models. Now, Formlabs just recently released a built platform 2. It's still on back order, but I got one of those where you can just bend it, press on it, and the prints pop off of the platform. You can see that on one of my posts in the 3D printing Facebook group if you're interested in that, which makes the post-processing a little bit easier. And of course, we're using pressure formers because right now we still don't have in office the ability to print the aligners directly. All right, so we're using pressure forming this is my dental assistant here actually making the aligners, and we have an assistant that is dedicated to doing this, by the way. We hired somebody pretty much just to do this. Now she does other things, but about half of her morning is spent making aligners, depending of course on the volume that you're doing, right? But here she is fabricating a liner using the Diplomate. The BioStar Mini-Star is also capable of doing this. You do need a pressure forming device rather than a vacuum forming device. A pressure forming device will give you the accuracy that you need. And of course, there are courses out there on how to do this as well. But that's what it looks like. And then, there is some manual labor involved, but this can be done very quickly. We teach techniques of how to trim these up very quickly as well, and also the different materials and so on. All right. Of course, the holy grail of clear aligner, in-office clear aligners, is going to be printing directly the clear aligner to avoid having to print all those models. It's not quite available yet. There's a company called Davie that's out there with. They do have some resin that is available, but I don't believe that they've actually started selling this to any particular company, but they have done testing with the Sprint Ray Pro, the Unislash, and several other printer companies out there they're working with. Hopefully this comes to the market soon. And there is at least one study out there already that shows that this holds great promise for doing aligners in office by printing directly. Hopefully Sprint Ray will be one of those companies that adopts this. Now, one thing to keep in mind, since we are printing models still, is the angulation of the prints. If you look at the study from the Journal of Prosthetic Dentistry recently, they talk about on desktop SLA printer, and it's the same thing for DLP printers, pretty much in my experience, is that when you print at a flat or at a 45-degree, you get the most accurate surgical guides. And this holds true for models I found as well. Knowing how to set up the prints on the platform is extremely important. And there are YouTube videos, but also we teach this in our courses. So the 90-degree build angle required the longest print time. That's basically straight up and down, but consumed the least amount of resin, but it was the least accurate as far as making surgical guides. And again, as I said, this is also true for models and things like temporary hybrids. So when we print aligner models, we aren't printing them straight up and down. We're actually printing them at an angle closer to about 60 degrees, all right? And then if you are printing things that require a high level of accuracy and precision, when I say accuracy, I mean across the arch, all right, then you want to print those flat with the intaglio surface up. The precision of each hole is not the accuracy. If accuracy is really, I'm talking about around the arch, because you do need both on these types of printers. And of course, this is, this is what you're trying to achieve, where your tie bases basically just drop in, or if you're using direct to MUAs, which we are now, your Rosen screws or your Powerball screws will just drop in, okay? And you can see this is the kind of accuracy we can get even from a low cost printer. This was printed on the Sonic Mini 4K using NextDent MFH resin. And as I said, we're able to print the Onyx resin on it now. We're able to print even the Flexir. Some folks have worked out the Flexir resin for this particular printer. But this is the kind of precision and accuracy you should expect, at least from your printers, especially the ones at the very high end. All right. And when you finish the characterization of it using different composites and staining techniques, that's kind of what it looks like. Okay. That will segue into what we're doing with surgical guides. So this is Dan, 73 years old, presents like this. Now, part of the problem with Dan is that these upper anterior teeth are sort of moving, so we can't really use them to make a surgical guide. The lower teeth were a little bit more stable. So the first thing we did for Dan was actually to make a denture, an immediate denture. So we did a digital extraction, went into BlueSkyPlan, designed a denture, and then 3D printed it. And that was the first iteration. That's the first one we put in. It wasn't actually very good. So after the gums healed a little bit, you can see we went ahead and did the lower hybrid for him as an immediate load case, but then we went back and redesigned the upper because he didn't like the shape of the teeth. He said the teeth were too small. And we then went and made another one very quickly in BlueSkyPlan, which allowed us to print and then change that out for him. So this is printed on the Formlabs with the DICOI resin. They are a reseller for the DICOI resin. They label it as a Formlab resin, but it's actually made by DICOI as well. And you have the denture teeth resin and the denture base resin, which are printed separately and then bonded together in that fashion. So these aren't the most attractive dentures. I did design these very quickly, and you can see we didn't do a whole lot of characterization or anything, but just as a temporary denture to get us to the next phase, which for this patient was upper immediate load hybrid as well. At least he had something to go home with. And then this is where we ended up with this particular patient. All right, so you can spend time in the denture module characterizing the tissue areas, the base areas as well. I'm not one that tends to spend a lot of time doing that, but certainly you can spend as much time as you want characterizing those and make them look, as good as you want. But this is where we end up with this patient, full upper and lower hybrids. These are actually 3D printed hybrids that we're using to verify the function and the aesthetics before we go to final zirconia. And these are printed on the Formlabs printer using their temporary crown and bridge resin, okay? Which, by the way, is made by Bigo out of Germany. So that's where these resins are produced. This is Linda, 82-year-old patient. Linda happens to be medically compromised. She's has a lot of needs here. All these teeth need to be extracted. And what we did for her was a set of immediate dentures, which were designed and then printed again separately. These were printed again on a Formlabs printer using the denture base and teeth separately. And I did have these designed outside. I outsourced the design on these, but you can do these in BlueSkyPlan as well. But this is how you're able to print the base and the teeth separately. And then using the same 3D printing resin that we use for the base, just dip a little brush in the tank and paint in the sockets and then put the denture teeth in and then do a post cure on that. And these are what they look like. So You can, of course, characterize them a little bit better than what we're doing. But here is the day of surgery now. We take out all the teeth. We try in the dentures. This is what they look like. And then we use soft line material to reline them. And the patient goes home with a set of immediate dentures. This is about a week post-op. She's actually healing quite nicely. And these are what the dentures look like in about a week. Of course, they have to wear denture paste, et cetera, to hold these in. And then what we did was we actually were happy with the design of those. So we used that to make the final dentures, which are conventional dentures, which brings up a good point. 3D printed dentures, in my opinion, are not really adequate for final dentures at this point. Hopefully some of the newer resins like the Flexura base and the Flexura teeth resins will prove long-term that they're as good as conventional acrylic. But right now, either milled or conventional acrylic techniques are, in my opinion, stronger than 3D printed dentures. So for 3D printing, we're using dentures as temporary dentures or immediate dentures, okay? And then let's look at another type of surgical case. This is Alexis. This is a single tooth case. Now, Alexis came in with an abscess on tooth number 7. You can see he's got internal resorption here, very close to the palatal, going through the palatal root. He's got a periapical abscess. So this is not a case where I would do an immediate placement. This is not a case where I would do something like partial extraction therapy. So what we did for Alexis was we did an extraction and socket graft and made him a Essex appliance to wear as a temporary. Now you can see the bony defects here periapically. We had the internal resorption here, and then also we have bone loss between number 7 and number 8. So keep that in mind because that's going to affect our final outcome. Not really an ideal clinical situation. So when we do a case like this, of course, we're going to use BlueSkyPlan to do the surgical guide because we want the most accurate placement possible. We let the site heal with the socket graft, and then we went back and placed an implant designed for a screw retained restoration. So the implant is placed. The case is now ready for impressioning. And in a case like this, because of the bone loss on tooth number 8, I do want to make a temporary crown, and so that we can develop the soft tissue as best as possible for this particular situation. So we use this temporary titanium abutment to make our temporaries, and this doesn't happen to be in the library of the BlueSkyPlan software. So what I did was I had a conventional impression done, made a stone model, and then scanned the tie base on the stone model. And this shows you the versatility of BlueSkyPlan. You know, your imagination is really the limit with the software. So we scanned it, and then I designed a crown over that, and then basically Boolean subtracted this abutment post out of that crown to create a cement on crown that I could print and then cement it onto that titanium base. So this one I printed on the accuretta sole using their Alpha 3D slicer software. You can see it's a very small print, just took literally a few minutes to get this in the software and maybe 15 minutes to print. But you can see how I was able to sculpt in the BlueSkyPlan software, sculpt the submergence exactly how I wanted it, which I usually start off very thin, a very small submergence, and then printed that. And then you can see the titanium base basically just dropped right into that. We cemented that with a self-cure resin, self-cure composite, or self-cure resin cement, polished it up and put it in. And then if we needed to add or subtract, we did that so that we applied the proper pressure on the mesial or distal or buccal to get the tissue as ideal as possible. Not the most ideal outcome, of course, but here is the final crown, which is a screw retained crown, which is zirconia on a tie base. But this is a kind of thing that we do routinely in the aesthetic zone so that we can get the soft tissue as good as possible. And this is a 1-year recall. I actually just took this x-ray a couple of days ago, on Monday actually, and photograph on Monday, 1 year after we had placed this restoration. And you can see the bone level was kept exactly where it was on the adjacent teeth prior to the extraction. And we have good bone levels on our implant. So I like to do these temporaries to develop soft tissue and make sure the aesthetics and the function are as good as possible before we go to the final ceramic or zirconia restoration, like in this case. All right. And if you do have the tie base available in the BlueSkyPlan library, you can make a crown, or crowns in this case, design crowns on those tie bases. You can actually do it from the planning stage if you want to do an immediate temporization. In this case, this is actually a video that was made by Michael Salzman for me to sort of show me how to do this technique. But there are videos on YouTube that I think Michael has put out showing how to design, using a crown and bridge module, to design crowns on tie bases like this. So that's what we did there. Anyway, so this is the temporary crown and bridge resin from Formlabs. And this is the resin we're using for a lot of our cases right now, because we have been using the Formlabs printer. As I said, this is made by BIGO. It's class 2 certified and class 2A in the EU. Comes in a variety of Vita shades. I find that the B1 shade is actually not quite a B1. It's a little bit darker. It's more like a B2. So keep that in mind. I'm not sure why that is. But if you really want a very light shade, then I would recommend a material like the Onyx bleach or the NextEnd MFH bleach shade as well, which you can then stain to different shades. But this resin is actually one of the first ceramic filled microfilled resins that was on the market. And it had a lot of promise for us because we could characterize it and make it look very similar to the kind of crown you could get with like milled crowns with emacs and so on. And of course, at a very low cost. So this is one of the cases where I used it. This patient was going to go to the periodontist and have some periodontal work, but he had this tooth that was fractured. I didn't want to go to a final crown right away. So we actually used this particular resin on this patient, which we did a temporary crown. Actually, this was their permanent crown resin. They have two versions of this resin, the temporary crown and bridge resin and then the permanent crown resin. They're very similar in properties, so I'm not exactly sure. Supposedly the permanent crown resin a little bit more ceramic filled and a little bit stronger, but I find them both to be very similar. The permanent crown resin is quite a bit more expensive though, but we put this crown in and we took an x-ray of it. You can see it looks very similar to an emacs crown as far as the radio opacity, which tells you about the density of this crown. And here I was using it as a temporary crown. Now, would I use this as a permanent crown? Probably not right now, because we do have the ability to mill at a very low cost also, emacs or even zirconia in our practice. But you know, it is an option that's available for maybe lower income patients. These can be done very quickly, which helps you reduce your cost. And then one of the resins that we're really excited about is this Onyx resin, which is also a ceramic filled resin from Sprint Ray, which is a very strong resin. It was designed for hybrids, but we are also using it for temporaries. And what's nice about this is it's highly polishable as well. So you can see the different strength information there for this particular resin. And it also prints fairly quickly. We are printing these at 100 microns. That's the only setting that's really available in the Sprint Ray settings right now. But I did talk to them about having 50 micron layer height settings for this resin. Hopefully they'll do that. You know, it will slow you down a little bit as far as the printing time, but I think it might give a little bit more accuracy. Although for the applications we're using it, it's not so much, but I know that people are starting to use this resin for things like veneers and inlays and onlays and such. And maybe for those applications, it might actually be better if we print at 50 micron resolution. So I think it's, you know, depending on your application, it might be, you know, if you want a faster print at 100 microns. If you want a little bit more accuracy, then you can print at 50 microns. And again, this is only available to print at 100 microns right now. Okay. So here's a case that I did actually just last week. We had a patient that came in and we prepped out the lower teeth, and I actually had temporaries designed ahead of time. And what we did was then we did sort of a Boolean subtraction from the pre-designed temporaries. And while the patient was waiting, we printed these on the SprintRay printer I think it took a total of about 40 minutes to print. And then we basically just wiped them clean. With this particular resin, you don't actually wash it in a isopropyl alcohol wash. You just kind of wipe off the resin, blow out the inside with some compressed air, and then you can put a glaze on it if you wish, or you can polish it using buffing wheels. I did put a glaze on this, but basically this is the best type of temporary you're going to get. You're able to cement this directly to the prep teeth, you know, so the tissue health and so on is going to be great. And of course, my assistant loved it because she didn't have to reline and trim out the temporary. Now, if you look real carefully, you can barely see the layer lines. And remember, these are printed at 100 micron. You can just barely see the layer lines. So if you print it at 50, it might be a little bit smoother, but I don't think it meant it really made a big difference here. And, you know, you're going to be putting a glaze on there as well. And then we have the Flexera resin from Envision Tech, which is, again, something new. They just came out with a new printer. I don't have one as yet, but this material is supposed to be a little bit more flexible. Let's see what happens with it. But, you know, again, new things that are happening, exciting things that are happening in the 3D printing realm. So that's available. So I'm just going to finish up here with a few cases of how we're using 3D printing in our clinical practice, as well as one case in our course. But here is a case. This is Donald. You can see presented with the need for full mouth rehab. And we decided we're going to do all annex upper and lower on him. We did the lower first. We planned out 6 implants with a stackable guide. So here is the pin guide that we used. We created a guide on the patient's teeth with the fixation pin so that we could then take out the teeth, put in the bone reduction guide, which would then be indexed with those pinholes. And this is kind of how I design all of my all on X cases. Here is then a drilling guide that sits on top of that bone reduction guide. After the bone reduction's been completed, we go ahead and drill through that to put in our implants. Here are some of the implants in. We put in all the implants, and then we will typically do this analog model, which is something that I also designed in BlueSkyPlan, and then have space for a rubber gasket, which we make on that model using the temporary hybrid as well, which is also designed in BlueSkyPlan. And then we have this temporary hybrid that this one was printed on the Formlabs printer. You can see how it fits onto the bone reduction guide. Okay, so this is not locked on in any way. We hold it in place and have the patient bite it to place as we do the pickup, which will typically be done by putting on the rubber gasket first and then injecting Luxatemp, which we then allow to set, remove that as one piece, hand it to our assistant who will do the finishing while we finish up the surgery by putting PRF membranes and closing up the site. This is the finished product. This takes my assistant anywhere from 20 to 40 minutes to do by adding pink composite. And we've been trying the stains from Taub Dental, which allow this process to go a little bit faster. The our standard for doing this though is using an axe gum pink composite to add the composite look, the pink gingiva. But this is now ready to be screw retained. So the patient goes home with this temporary hybrid same day. All right. And then once we did the upper and then verified everything with the patient's function and aesthetics and so on, we're able to duplicate that in zirconia. And this is the final smile for that particular patient, which we milled in-house as well. All right. This is Tina. She's 37 years old. And in this case, we had a little bit of a challenge in our treatment plan because I had originally planned her for upper and lower all on X. And I don't think anyone can argue with that for this particular patient. All right. She happened to present with a temporary. She went to another dentist and had these upper teeth removed and had a temporary partial made, and then came back and we took over the case at that point and did all on X on the lower, and now she came back for the upper. So this is the lower, we did all on X there, put her in a temporary hybrid. This is an older case going back a couple of years now, and we certainly have gotten better with our temporary hybrids as far as the materials and making them look better. But this is how she was, and you can see she came in ready to do the upper. And I looked at this case and I thought to myself, I'm just not happy with my plan for the upper. I thought to myself, this is a young lady. She's 37 years old. Did I really want to take out her remaining teeth? Was there another option? So we did actually change a treatment plan for her. And what I did for her, this is what she looked like. You can see a significant defect here in the premaxilla, but these remaining teeth are actually quite stable and in fairly good periodontal health. So what we did was we did some block grafts. I went to the posterior maxilla and harvested block grafts from the posterior maxilla and fixated them. And we basically grew the bone in the premaxilla so we could put implants there. Now, interestingly, what I did was I left enough bone behind the second premolar so that I could put one implant on each side. So she's going to get a full set of teeth on the upper, back to first molar occlusion. So we let these bone grafts heal for a while, then went back into our BlueSkyPlan software with a new scan and planned out 2 implants for a fixed bridge. This is my preferred way of doing this type of case. If we have teeth, the incisors missing in the upper jaw, we place those, very precise placement. You can see how thick we were able to grow the bone here using autogenous bone. And then we got 2 implants in the posterior as well. And when we got to this stage, of course, now I need to temporize this and try to develop the tissue somewhat. To be frank, I didn't spend a lot of time developing the tissue here, and you'll see the result of that. But this patient sort of got burnt out with all this treatment, and we can always go back and do that. But we did do a little bit of tissue development. I was planning actually to put some pink porcelain on her final restoration. So what I did because of that was I went into BlueSkyPlan and designed a denture for the upper here using the denture module, and then printed that. And when she came in, I put that in, and you can see these were printed on a Formlabs printer using a Formlabs temporary crown and bridge resin. And I ended up trimming these back because I thought, maybe we can get by without doing pink porcelain. So I trimmed these back and did a little bit of tissue development. This is what it looked like when she smiled. And we ended up at this stage. And again, we could do more tissue development here, but she was quite happy with the result. This is a lower zirconia hybrid. And then on the upper, we have, this zirconia bridge that's screw retained on these implants. So of course, we could go back and do crown lengthening on these teeth and make the canines look bigger and so on. But this patient was quite happy with the result. Finances are a little bit of an issue for her. It took all it could to get to this stage. So she was quite happy with the result, and that's, to me, success. All right. So just to summarize, and I'll finish up with one additional case, which is why in-office 3D printing? We are doing it, of course, to reduce our costs. More than anything, it's the convenience, so we can start cases very quickly. And then for me, a lot of it is control. I am very happy to be able to change things and do things very quickly. As a matter of fact, I'm actually quite a procrastinator. So a lot of times for my surgical guides, I'm designing them the night before. And because I am teaching courses and so on, we get very busy, so things sort of fall through the cracks. So by having the ability to design things and print them very quickly, it gives us a lot of control. So here's an example of that control. Last week, we had our live surgery on last Friday, at our implant continuum. And this was one of the cases that we did. So I did not get the final data sets. This was a case that was sent to us by one of our past doctors who took the course. This patient couldn't afford to have treatment, so we did the treatment, at least the implant part of it, at our implant course, where the doctors in the course got to actually do the treatment. So I got the data sets last week, Monday, and we did 3 other cases. So on Monday, I planned all of these cases out between Monday and Tuesday, printed everything on Wednesday, and then Thursday we traveled to the course, and Friday we actually executed all 4 cases. But this was the most complex out of the 4. The rest were just simple 2 supported guides. But this is where the patient started. Now, what had happened with this patient was we saw this patient last year in our implant continuum and decided we were going to do an all-on-X treatment for the patient. But the problem was the patient just didn't actually have enough bone in the premaxilla for that. So the other option for this patient would have been a zygomatic implant. Now, that's a lot more complex. And of course, we are not able to do that in our implant continuum because we don't do those types of cases. And the costs would have been prohibitive for this patient. So what we did instead was, in our implant continuum, the doctors in the class got to do some bone grafting. So we did lateral augmentation in the premaxilla to prepare the patient for fixed hybrid restoration with implants. We did not have enough bone. You can actually see the original bone level here. And last year, they grafted the sites using tenting screws and allograft and xenograft materials. And they did this under our supervision. And you can see now this is the recent X-ray that we used to plan out the all-on-X case. So you can see how much bone they were able to grow there. The key to this, of course, is having a fixed temporary. So this patient was in a fixed temporary so that no pressure was placed on the grafted sites, right? So what we did was we planned this out now. This is what I was doing last week prior to the course. It took me several hours to plan this case because we're going to do stackable guides here. And what's nice also was that the doctor who sent the case actually did a wax up using BlueSkyPlan. So he did the digital wax up for the teeth. I didn't have to do that myself, but he did the digital wax up for the case. And I was able to use that to actually design the temporary hybrid. So here's the case now clinically, and we'll walk through the steps of how we actually executed this case. So this is what the patient presented with without the temporary. This is a fixation pin guide to index the additional guides that we're going to place. Okay. Now, the problem with this type of case in this particular situation was that the pinholes would interfere with our tenting screws that were already under the tissue. So we could not use this guide initially. We did it just to try it to make sure it fit, but we actually had to retrieve the fixation or the tenting screws first. So we found the best way to do this in this particular patient was to actually lay a flap. We're going to lay a flap anyways, but we then removed the tenting screws, and you can see how the bone level grew out to the tenting screws. And then we were able to seat our fixation pin guide and drill the holes for the 3 fixation pins. because now the screws were removed, they wouldn't interfere with drilling. Then we extracted the teeth, put in our bone reduction guide, which indexed to the 3 holes that we had drilled previously and also fit on the distal end here on the bone. Did the bone reductions. And again, this was done by the folks in our implant continuum. So they got the experience of doing an all on X case. And then we put in the drilling guide. Now this is an open style drilling guide that I designed. And what we're doing here is actually pushing the tissue out of the way to make sure that this seats properly. So the seats on the bone reduction guide fully, and then the sites were drilled. These are the implants now in place. They were also placed through that guide for the maximum precision. And if you look through now, we can place the temporary hybrid, which also fits onto the bone reduction guide. You can see the implants through the holes that we had made prior. And now we put in our multi-unit abutments and did a pickup. And while the pickup was being finished by my assistant, this is what it looked like. We then did the closure. So the closure is done, like on the previous case. And what you see in here now is the temporary hybrid being fixated. This is and of course the bites adjusted, and this is polished and so on, but we were doing a try-in here to make sure that it would seat back in accurately. And this is a post-op scan of where the implants ended up, 6 implants for a fixed hybrid. This is a post-op scan as well of all the 6 implants. And then this is the temporary hybrid that the patient went home with. All right, so this was one that we stained with the TOB stains rather than the Anax gum. So, we did this rather quickly because it was in our course, but these can actually turn out to be very nice as well. So that's how this was printed ahead of time on the Formlabs printer. You can print these with Onyx from SprintRay. You can print these with Nextent MFH. In my course, I teach how to design these and how to make them so that they last. There's certain parameters that you have to follow, such as having enough material around each of those holes, etc. And then also one thing that we're doing is, if you have the access to photogrammetry, we're actually able to print these now after the implants are in. So you can take a photogrammetry scan of the actual implant positions, have the design already done, and then recreate the intaglio, attaching it directly to the actual implant positions, which then you don't have to do the pickup part of it. All right, so that's another technique that we are doing, but it's not mainstream at this point, in my opinion. All right, so look for new things coming from that realm as well. I'm trying to develop a lower cost technique rather than photogrammetry, using Michael, the Ferguson impression inversion technique. So look for that coming soon, okay? And of course, these are the courses and so on that we give. And there is my email address. I did see a few questions that I'm going to try to answer here. Okay, let's see. So with that, before I answer the questions, I did want to thank Michael and BlueSkyPlan for being very supportive of what we're doing and providing the tools that are the foundation for everything that we do in our clinical practice and in our courses as well. Okay, let's see. A couple of questions. Pedro Perez asked, first I want to tell you blah, blah, blah. Can you explain when I print an STL final DO printer, what is the offset we should use to compensate for contraction of resin after printing, or using POS cure? I'm not sure what that means. So Pedro, if you're using a DLP printer, there shouldn't be no offset. All right. The only time you should be having to put in any compensations is if you're using one of the lower cost non-dental printer where you've sort of worked out the settings on your own, or maybe you've gotten the settings off of our Facebook group. Okay. But you should not have to be putting in compensation factors for contraction. All of that should have been worked out by the manufacturer. Okay. The Facebook group is Dental 3D Printing Facebook, Dental 3D Printing Group. Just type in a search for groups in Facebook. It's called Dental 3D Printing Group. You can email me if you can't find it, and I will be happy to send you an invitation to join that group. Okay. What is the specific technique of creating clear aligners? Again, I'm a little confused about that, that question. Basically, what we're doing is planning the movements of the teeth in BlueSkyPlan, printing the models that for each step, and then fabricating on that a vacuum form or pressure form, I should say, aligner. And then what are the best way to make bone surgical guides? It's a little bit of an open-ended question. We like to do bone reduction guides from a bone segmented model. That's the best way to make a bone surgical guide. It's a sort of a complex technique. There are some videos on YouTube from BlueSkyPlan, but also we do give a course on that as well. So go to digitaleducators.com if you want to look at that course. I would recommend that you really be a master of BlueSkyPlan before you take that course, because it is you know, quite a feat to go through all the steps. But once you understand it and understand the workflow, it can be fairly straightforward. The Onyx ceramic has embedded much stronger than Varsia, but is still only resin. Yes, the Onyx ceramic resin is still a resin, and as such, it is brittle. Okay, there is some thought that Flexera is a little bit more flexible, but I haven't had a chance to really use that for temporary hybrids as yet, or etc. But I do like the polishability of the Onyx resin, and it's certainly strong enough. It's very similar, in my opinion, to milled PMMA. So that was the standard prior to 3D printing temporary hybrids, for example. So I'm very happy with that. We have about the same success that we do with PMMA. So if your patient has a strong bite and they're going to break PMMA, they're probably going to break these just as easily. Okay. So Michael, if you have any words to finish up, I think we are done.
Yeah, well, first of all, Rick, I'd like to thank you again for such a fantastic presentation. Thank you for the ongoing education that you provide regarding BlueSkyPlan, digital dentistry, dentistry in general. Just looking at that Excel sheet is just one example of the phenomenal amount of work that you put in to making dentistry accessible and just more feasible for many, many other dentists around the world. So thank you very much. It's I personally appreciate it, and I'm sure many others appreciate it as well.
It is a labor of love, and I just wish there were more hours in the day. But it's fun, you know. Once it stops being fun, I will stop. Okay. So again.
Okay, I'd also like to point out that, as Rick mentioned, on BlueSkyPlan.com, the education section, we have a lot of videos on kind of using the nuts and bolts of the software. It's a good place to get started, especially before going to the courses that Rick presents. I definitely recommend checking out his websites that's on the screen now to find out more information. And he's generously sharing his email address as well. So those are all great opportunities. As I mentioned at the beginning, just to review a few points, we have the upcoming webinar sessions posted on our website, blueskyplan.com/webinars 2022. So please check out upcoming presentations. The CE credits are generally sent within a week or two after the presentation. And I think that's pretty much a wrap. We look forward to seeing everybody at future presentations. And Rick, thank you so much. It's greatly appreciated.
My pleasure. Take care, everybody.
Okay, take care.